All right, good afternoon, everybody. Thank you for being here for our press briefing with regard to what the state is doing to slow the spread of coronavirus in Nebraska. We're obviously here at a different time today because I've got my radio call-in show at 2 p.m., so we will make this a briefer briefing. With regard to it, we got a couple of guests today, actually one guest in particular, Betty Meetinger, who is the Senior Vice President, Nebraska Children and Families Foundation. But before we get to her, as always, I want to remind people about our 6 rules to staying healthy. So even though we've moved past the 21 days to stay home, we want people to remember the 6 rules. And of course, the first one is still, don't take unnecessary trips outside the household, okay? So while we're kind of moved beyond that 21 days to stay home, we still want people to really keep the best practice in mind of no unnecessary trips outside the household. Second, we still want people to work, so go to work, but work in a socially distanced way if you're going to work, and then work from home if you can. It's still a good idea to work from home if you can. We still want people to shop, so shop, again, once a week. Don't take the whole family. We still want people to make sure that they're doing all the right things as far as having a list and being efficient. Go to the store once a week, get what you need, come home, have a list, be efficient. Go into the store, get out of the store. Those things are all there. And of course, we still want people to help children, our number 4 rule, by keeping them home to play, avoid sports groups, avoid playgrounds. Those are things you all can do to help children socially distance. We also want to help our seniors, run errands for them so they can stay home, so they don't have to go out, shop for them, whatever they need. But don't go visit them in a nursing home. Okay, that is not something we want people to do right now. And then finally, exercise every day. Do it in a socially distanced way, or do it at home, but exercise every day. So those are our 6 rules to stay healthy. And then, of course, we want to remind everybody about testnebraska.com. Testnebraska.com is the way that we are going to use and collect data to be able to see where we need to be testing around the state, and then use that to be able to schedule testing. We've got 137,000 people that have signed up now. And last night, we sent out an email to everybody who had signed up, asking them to update their health assessment. You can do this just by clicking on that link of that email you got, or if you just go in and just use the same email address, the database will link it all together and make sure that if you update your health status or whatever, it'll get reflected there in the database. We are also rolling out our soft launch of testing today with sites in Omaha at the CHI Healthcare Arena. So we're going to be there from 1 to 6 today, but you will need an appointment. You can't just show up. But this is where we're going to start doing our testing in Omaha. And then we've been in Grand Island since 8 o'clock this morning doing testing at the State Fairgrounds in Grand Island. So again, you would need an appointment to show up. We send you out an email, gives you a 30-minute window to be able to schedule that and get the swab taken and so forth, and then we'll turn that around and process it back to you. So, but that collecting of those samples is starting today with regard to testnebraska.com. I think another good reason for people to go out and get the assessment, get updated. I want to thank the National Guard for all the great work they are doing. Just the men and women of our National Guard folks, we can just be so proud of them. They are just doing a fantastic job. They are all over the state. They're setting up these teams to be able to help do the testing. They really have been doing fantastic work. So I just want to give a big shout out to our Nebraska National Guard. They're doing fantastic work, so thank you. Also, we've got one of our billboard companies, Lamar, which has been using some of their spare space on the billboards to be able to put up our testnebraska.com messages about getting signed up for testnebraska.com. So I want to thank Lamar for giving us some of your spare space to be able to help promote testnebraska.com. Also, I mentioned this last week, I've got a YouTube channel. And if you go to YouTube and just search Governor Pete Ricketts, you can find it. You know, Governor Pete Ricketts channel, you can find it. On that website, we've got videos both in English and Spanish with regard to testnebraska.com. So we encourage you, organizations, to use those videos to be able to help communicate out why we want to go to testnebraska.com. So that's all out there as well, so please feel free to take those videos, share them around your organization to help promote testnebraska.com. We want people to sign up. This is, again, how we're going to assess our state, be able to schedule those appointments, and be able to get the testing done. That's going to be so important for us loosening up our restrictions. Today is May 4th, So today is the first day, for example, some of these looser restrictions. Statewide, for example, houses of worship can be exempted from the 10-person rule, though they have different social distancing guidelines that are out there. Elective surgeries can begin again as long as hospitals within certain guidelines are meeting those rules. So those are two important things. And the counties that we have released, relax some of the restrictions. Restaurants, for example, can operate at half their rated capacity. Salons and barbershops and tattoo parlors and massage therapy and so forth, they can start also operating under the 10-person rule. So a number of things are going on today with regard to that. But again, to see continued loosenings of these restrictions, we've got to be able to do the testing and we've got to be able to do the tracing of people. TestNebraska.com will help us do that. So please sign up if you haven't already. And then once you sign up, go get 5 of your friends, do the hashtag TestNebraska.com and get that out there so we can really leverage the power of social media to be able to get people to sign up for TestNebraska.com. All right. So now one of the things that we also know is that with the rules, and we actually updated our rules so that child care, daycares could have 15 children, not 10 children. So that's been updated in the DHMs where we've loosened some of those restrictions. So 15 kids per classroom, not 10. So that's been updated as a way to help provide more child care. But we know that many parents are looking for the ability to find that child care. And that's why we have Betty Meninger here today to be able to talk to us about what the Nebraska Children and Families Foundation has been doing in conjunction with our Department of Health and Human Services and the Nebraska Department of Education to be able to help parents connect with those child care resources that are out there around the state. They've got a website, anychildcarereferral.org, that is out there to be able to help parents find those resources. And with that, Betty, I'm going to ask you to come up and give us some more detail.
Okay.
Thank you, Betty.
Thank you, Governor. I'm just here to talk a little bit about, as a response to the COVID emergency, Nebraska seemed to have a urgent need more than ever for parents to know and be able to find who's got an opening right now and where are they located in the state. Are they close to me? So we looked at the resources we had, and while things were online, it was kind of clunky and not very easy to navigate. So a group of us got together. We've been on phone calls in the morning for about 4 weeks now, every morning, and now we just went to once a week. But to get this launched, it took a lot of people, pretend there's about 63 people standing here with me right now across the state that had to figure out how we were going to do an inventory across the state with accurate, up-to-date data because it was changing on a daily basis, and how we were going to build the technical part of all of this on the website to get it launched. And so our thanks to the Department of Health and Human Services, the Department of Education, the Nebraska Early Childhood Collaborative in Omaha, Nebraska Extension, First 5 Nebraska, the Buffett Early Childhood Institute, and other university departments to help us pull this all together. It also involved the educational service units across the state, 7 of those that have early learning coordinators. They've been key to this on a regional basis of information. So this has been up for 2 weeks. It is www.anychildcarereferral.org, and it's up here on the board, so if you're having a hard time remembering that, there it is. And we hope this is the beginning of being able to find information. It builds a base for us to go forward in the future for a robust child care resource and referral tool in Nebraska. So, any questions?
We can pick up at the end, Betty.
All right, great. That's all I had to say.
All right, great. Thank you, Betty.
I'll try not to take your notes with me this
You
time.
wouldn't be the first person.
Yeah, I've seen that.
Thank you, Betty. All right, great. Also, just wanted to make people aware that the federal government had put out about $10 billion in assistance to critical access hospitals. Nebraska received about $272 million of that for our critical access hospitals. So another source of funding for our hospitals to keep them open. So we're very pleased about that and thank the federal government for that assistance, especially for our critical access hospitals. And that's, again, one of the reasons why we wanted to start opening up elective surgeries, is to be able to not only be able to make sure we're serving people who need those surgeries, because again, Elective doesn't mean unnecessary, it just means that they were scheduled. But not only will that help those folks who can now get access to those surgeries, but it will also be a source of revenue for those hospitals to help make sure they can stay in business to serve not only the people who need those surgeries, but anybody who comes down with coronavirus. Also, just wanted to remind everybody that 2 p.m. Central Time, the rest of this week, will be when we're doing the briefings here in English. We will do Spanish press briefings at 5 p.m. Central Time on Tuesday and Thursday. I will again be on NET Thursday night from 8:30 to 9:30 on Speaking of Nebraska. And I believe that is all we have for today, except for the questions. So let's go ahead and roll into the questions. Christian Wagner from NTV. Has there been anything new out from Washington when it comes to the possible COVID-19 relief for the ethanol industry? I have not seen anything new from the ethanol industry, but thank you, Christian, for continuing to highlight this, because this is a hugely important industry for the state of Nebraska, and was already in having some issues with regard to what the EPA was doing, and now this on top of it with the low price of gasoline has reduced demand for people not driving, reduced the demand for ethanol, and that's where 40% of our corn crop goes. So that is something that we would love to see the federal government take up as far as a relief package. President Trump Sunday night said he would like to see universities and colleges open back up and have class in the fall. What are your thoughts on that here in Nebraska? Well, the University of Nebraska has already announced that they're planning on having kids back in the fall. I think that's a great idea to put that marker out there and start working on the plans for being able to make that happen. Not going to look like it did last fall when students came back. There will have to be steps with regard to social distancing, but being able to start doing that planning now, I think, is going to be important. Melanie Wilkinson, York News Times. Over the past few days, some business owners and patrons in York have been reporting that they are seeing higher influx of individuals from Grand Island, Hall County, in this community. With the loosening of these restrictions now starting in our health district, some here worry that more individuals from health districts where regulations have not been loosened will begin to travel into other districts and possibly heighten the threat of community spread. Can you address the issue? As we said last week, if you're in one of those districts where you've got a directed health measure that is more restrictive, we ask you to continue to follow those more restrictive guidelines. If you can at all, please avoid going to other districts to go to restaurants or things like that. We're really trying to make this a regional approach, but there are going to be border issues, just like there are border issues with the states. But we are asking people to do the right thing, can continue to stay home if you're in one of those public health districts where the restrictions have not been loosened, in order to help slow the spread of the virus here in Nebraska. Andrew Mim, KGFW. Why not you issue DHMs county by county versus health district? Again, what we do is we work with the public health directors in the public health district on these directed health measures. So in the past, you may recall that when we rolled them out, we did not strictly stick to all the public health district, and we did sometimes do on a county basis. We may decide to go back and do that again in the future. But for the time being, what we're doing is working with the public health directors as we start to loosen these restrictions. And again, let me take a step back here, right? So we're loosening these restrictions. We're doing it in a step-by-step fashion. We may change the way we loosen those as we see we've got success in loosening them and still preserving the healthcare system, which is the whole goal of everything we're doing. Make sure that everybody can get access to that hospital room, that ventilator. So we may do that down the road, but as we gradually roll out these loosening of the restrictions, we're going to do it on a public health district basis so that we can work with that public health director on how that's working out. Doesn't mean it might not change in the future, but right now we're not going to do it on a county-by-county basis. Nancy McGill, Hebron Journal-Register. Why are churches open statewide and not subject to the 10-person rule, but hair salons and restaurants can't operate in counties like ours, Fillmore and Jefferson, where there are little or no cases until May 31st? Well, first of all, I think, again, it gets back to we're looking at this on a public health district basis. So that is in a public, Fillmore and Jefferson counties are in a public health district that has other issues going on in it. So, again, doesn't mean we might not pull those counties out at a later date, but to be conservative as we're loosening these restrictions, we want to make sure that we're managing it in a way that is not going to impact the healthcare system. And so we're going to continue to do that. Churches, specifically, as I talked about last week, we made the decision on doing that statewide because one of the things we need help with is reaching communities where English is not the first language. And so we want churches to be able to help us reach out to those communities because they're trusted, they're in the same languages, and that's one of the ways that we can reach those communities about the importance of social distancing. So there was a cost-benefit trade-off we made with regard to that, as well as just the need in general for that spiritual help that everybody needs, especially at a time of crisis. So I think I think everybody can kind of see there's a difference between houses of worship versus a commercial operation, and that's why that received a higher priority. Don Walton, Lincoln Journal-Star. Question, prompted by readers. Can personal data collected by Test Nebraska be accessed by law enforcement or anybody else in the state? And no, the test at nebraska.com data will only be used as far as the assessment for where the state is and determining where we need to deploy testing resources as well as scheduling those resources. It will not be accessible by law enforcement, so, or anybody else for that matter. We're not selling the data. We're not either in aggregate or individually. We're not, we're keeping that data in an encrypted database, so it's gonna stay safe and secure. It's only gonna be used by the state with regard to responding to this coronavirus. Scott Miller, KNEB, also had a question that perhaps the governor can address. With understanding that health officials want to keep the public attention on the need to socially distance and take other preventative steps against the pandemic, keeping the pedal to the metal, so to speak, why doesn't the DHHS dashboard also include information on recoveries? So recoveries has been a lower priority. One of the things you have to do with regard to recoveries is you've got to be able to trace people, follow them all through the course of their disease to know when they recovered. We also have been working on tracing people who are getting it for the first time and making sure they're isolating and quarantining. So the priority has been the latter case. So some public health districts are collecting recovery data, but it's not necessarily complete, and we, the state, don't have the, not every health district is doing it, so we don't have a way to actually pull together a statewide number. So some public health districts are pulling that information together, but it's not necessarily complete, and so since we don't have a complete picture at the state, we have not reported it. Now, at some point, we do want to be able to report on that down the road, but the priority is going to be, again, around isolating people who are determined to be positive with coronavirus, getting them to stay home, getting the contacts of all the people they've been around for the last 2 weeks to make sure those folks are quarantining. That's what our priority of our contact tracing program is going to be. Juliet Connolly, Omaha World Health. Will there be guidance given by the state about how hair salons, massage therapies, nail salons, et cetera, are to use masks? Are they required by health directive to wear masks, or is it a guidance suggestion? What happens if a client takes it off so that a stylist can cut hair properly? And then the follow-on question to that is, what happens if they don't follow the rule? Is it mandated? Could their license be endangered? So the rule about the masks for hair salons, barber shops, tattoo parlors, massage therapy, that is in the directed health measure itself. That is a part of our directed health measure. So this is not guidance, this is part of the law. So yes, it is mandated that you follow this. It is a misdemeanor violation if you don't follow it. So if a client takes off their mask, I would request that the stylist remind the client to put the mask back on. Should a law enforcement officer stop by and see it, the law enforcement officer might write you a ticket for the misdemeanor. And could that potentially endanger somebody's license down the road? Well, you get enough tickets, if the salon owner gets enough tickets, I suppose it theoretically could potentially endanger that license. But I think the key thing is focusing on people to comply. Keep the mask on. There's a reason why we're asking you to keep the mask on with regard to those businesses, because you are in such tight quarters with those folks. Please keep those masks on. And I think we covered all those questions then. All right, so questions from the audience. And Grant Schulte, so good to see you here. You haven't been here in a while, so thanks for joining us today. No pressure on asking a question, though. Questions? Go ahead, Paul.
I got two questions. One is on personal property tax. You did waive the penalty on personal property tax and did waive the deadline. Why do it for personal property tax and not for real property?
So the personal property, as I mentioned last week, we're looking at it with regard to what the ramifications would be on the real property tax versus the personal property tax. The issue with the real property tax, it has a much bigger impact on our counties, cities, NRDs, school districts. So we have to be much more careful with regard to what we would do with regard to those entities, because it makes up a bigger portion of their income. If those revenues were to go away, for example, talking some county board members, they say they wouldn't be able to make payroll. Well, that's bad from the standpoint of making sure that we can continue to have sheriff's service, EMTs, all the things that are important in protecting public safety.
It's just bigger money.
It is bigger money, yeah, so it's bigger money, so we'd have to be more thoughtful about how we might waive those
Why
penalties.
not allow people to pay part of it? I mean, if you're asking people to pay all or nothing, wouldn't it make more sense to?
So, and the question was, why not just pay part of it? We're reviewing that as well, but again, since it's a bigger part of the overall revenue stream for these entities, we want to be more thoughtful and careful about how doing it so we don't have an unintended consequence.
When might you have a decision on that?
Don't have a timeline for you and when we would have a decision on it.
And today, in the county in which you live, you can go out to a restaurant as long as you don't exceed the half capacity. Do you plan to go out? Do you recommend that people go out?
So the question was, starting today, restaurants can be open, and do I recommend people go? Am I going to be going out? I would certainly recommend people do what you are comfortable with. So if you are comfortable going to a restaurant, then go to a restaurant. However, if you are in one of our high-risk categories, if you're older, if you've got those underlying health conditions, avoid going out where you've got other, crowds of people in the public. That is going to put you at greater risk. So I would say that you need to do what you're comfortable with, but a reminder to everybody who is a little bit older or has those underlying healthcare conditions, things like diabetes or respiratory disease or pulmonary disease, asthma even, those kind of things, you're going to be putting yourself more at risk if you go to those restaurants. And then the follow-up question was, I'm planning on going? You know what? I probably will go out to a restaurant at some point in the next week, yes.
Yeah.
I just haven't made any plans yet, so. Yeah, Grant.
In the districts where where we're now loosening the restrictions, what metric are you going to be using to measure whether it's working and whether or not you should retighten or loosen further?
So Grant asks, what are we going to be looking at to decide whether or not we should be tightening or loosening restrictions? And again, folks, it all goes back to preserving the healthcare system. A lot has been made about talking about the number of cases and so forth, but as we test more, we're going to get more cases. And as we test different populations, that also changes that variable. So that's really, it's a good leading indicator in some places that you might have an issue for your healthcare system. And so, for example, we used that in Dawson County with Lexington when we saw that the number of cases we're testing there were reaching 30% or more. We said, okay, we better start moving people out of that hospital to make sure that it isn't overwhelmed, and we've successfully done that, right? The hospital there is stable, it's handling patients, we've moved people when we needed to. So that's kind of what we use it for, but as you test different populations and you change how you're testing people and you've got more tests coming online with Test Nebraska, you're changing that variable. So it's not a real good, consistent indicator. But again, the whole goal of what we're doing is about the healthcare system. So we monitor very closely what is going on with regard to our hospital beds, our intensive care unit beds, and the ventilators. So that is what we will be using for all these decisions. If we can start loosening these restrictions and keep the healthcare system preserved and stable, then we know that we can take more steps. If we start seeing that we're at risk of having that healthcare system not be able to provide that hospital bed, then we will look at tightening those restrictions. So it really gets back to what are we doing with regard to how we're preserving the healthcare system? Yeah, John.
With everything open up today, whether it be restaurants, salons, and church services, my question was on enforcement. Is it gonna be kind of just if somebody sees something to call a police situation, if these places aren't following the guidelines, are law enforcement gonna be doing random checks? How is that gonna go?
So the question was, now that you got the restaurants being open, how is that going to be enforced? Typically, it would be up to local law enforcement to do the enforcement. And so what I would suggest, though, is if somebody sees somebody who they think is not doing the right thing, first thing you do is you could just go talk to them, ask them, say, hey, can you do a better job here? Generally, when we've reached out to people, businesses, for example, that we thought could do a better job on social distancing, they've been willing to accommodate us and do it. So I would say if that doesn't work, then contact your local mayor. That would be the next best stop, and have the mayor maybe talk to that restaurant about trying to do a better job on following the guidelines with regard to social distancing. So, again, ultimately, could the police go in and write a ticket? Yes. I think the Nebraska way is really, let's just start by talking to people. Fred.
Yeah, on Friday, when you gave the statistics for the cases in long-term care and the deaths, you said that information would be available in the aggregate, but you wouldn't specify where. Why not?
Just in general, our policy is going to be that we're going to provide that data in aggregate, but we're not going to provide it on an individual business organization. So that's just the policy we're going to be following because we don't want to pick on individual businesses. It may unfairly damage their reputation if there's other extenuating circumstances. So we're not just going to give it out in general. We're going to follow the rule that we're going to give out in aggregate, but not for individual businesses. Paul,
Nobody else?
anybody back there? Nope, Paul, looks like you.
Over the weekend, I drove through Omaha. It was a necessary trip. But we also had a health official there saying he was, I don't know if alarm was a word, but, you know, there are a lot of people at Walmart, there are a lot of people at Menard, their Hy-Vee's parking lot was as full as it could be. How concerned are you that people are now saying, all bets are off, we can go out and be like ourselves again?
So Paul was out driving around Omaha. He says it was a necessary trip, but he saw there were a lot of people at the stores and the parking lots and so forth. And again, just a reminder that all those organizations need to continue to follow the good social distancing guidelines that were established before our 21 days to stay home. And again, I'll use the box stores as an example of stores that we had talked to. The mayor of Omaha, for example, did a great job of reaching out to them and asking them to do a better job on the 10-person rule, and they complied. And they did it. So they limited how many people are coming in. I think I just saw Costco is going to require everybody, for example, to wear masks to go in. So I think Nebraskans, by and large, will continue to do the right thing. And again, I encourage people that if you get real data, okay, so let's not tell stories here, but let's get real data about specific cases where somebody may not be, and then we can have an official like a mayor reach out to that organization and say, hey, you need to do a better job or something like that.
But it doesn't look like they're doing the right.
Well, again, you have to have data. We can't tell stories about what it looks like. You actually have to have data. How many people are they letting into the store? Are people staying 6 feet apart? Do you have that kind of thing. So again, what I encourage people to do, everybody's got a camera on their phone, right? So if you do see an example of how somebody's not doing a good job, take a picture of it, go talk to the store manager. If that doesn't work, go talk to the, let the mayor's office know in whatever city you're in and have, share the picture with them and have them reach out to the company.
So it's not gonna be your call, it'll be the mayor's call?
Well, again, we're asking Nebraskans to do the right thing. And ultimately, we're asking to start the conversation. Let's do it the Nebraska way. Let's talk first. All these things can be enforced because these are DHMs, they are law, and it's a misdemeanor to violate. But the better thing is to have people just comply and do the right thing, and Nebraskans have been doing that. So let's just continue to have the dialogue. If people are getting too loose with some of these rules, let's follow up with them and ask them to do the right thing. Grant?
We talked a lot about Omaha and Lincoln, but have you heard concerns from mayors or other officials out in Kearney or North Platte or Scottsbluff or places outside of our immediate area?
Have I heard concerns about mayors from other locations? I have not had specific conversations with mayors that are concerned about people not following the rules. In fact, most of the feedback I'm getting is that a lot of our communities around the state are feeling like it's time to loosen up rules. So that's more of the feedback I'm getting in right now with regard to the rules. Not that they're worried people aren't following them, but they're more worried about, hey, isn't it time to start loosening some things up? I mean, if you look at the Panhandle yesterday, I think we had over the weekend 3 cases. They're up to 50 maybe, something like that. I mean, so the point is, different parts of the state are being impacted differently, and so they're looking at how we do this. And again, we want to do this in a way it's going to be, a step-by-step fashion to make sure we preserve that healthcare system.
We have a question from Andrew Ozaki. He wants to ask Dr. Anton about the new antibody test and how accurate it is, and how valuable having this information would be if it proves immunity from the virus.
Dr. Anton, will you please come up here and talk about the antibody test, please, for Andrew Ozaki?
So Andrew Ozaki asked about the new antibody test, and I did hear that the Roche company has put out an antibody test for emergency use authorization. So there's 2 types of tests the governor's talked about quite a bit, the antigen test and the antibody test. So an antigen test is like having a sliver in your finger. It's a foreign body, and your body tries to fight it off, and it's the antigen. So that's what the swab does in your back of your pharynx or back of your nose. It actually tests for that virus particle, and then they use the polymerase chain reaction to amplify that RNA to say whether you have that virus at that time. The antibody test is after you have that foreign body inside of you, your body tries to fight it off and it makes antibodies, proteins that try to destroy that foreign body, just like when you have a sliver in your finger, your body tries to get rid of that sliver, and that's why you have that redness and inflammation. And actually, it's that inflammation that causes people to really get sick. The inflammation around your lungs causes your lungs to fill up with fluid, and that's why you need a ventilator. So these antibody tests will tell whether you've actually had the viral particle and you've formed antibodies against that viral particle. So it's not saying whether you have it at that time or not. It's just saying at some point in time, you probably did have it, most likely, and you fought it off, and you might never had symptoms at all. So the antibody test will tell you you are probably going to be immune, at least for a period of time, against that viral particle. Hopefully, by the time next year rolls around, we'll have a vaccine, so we won't have to worry about whether you'll have that immunity or not. At least you'll have some immunity, but hopefully with the vaccine coming out, you'll even get a boost in that immunity. And even people that didn't have the viral particle, when they get the vaccine, will now have formed those antibodies. That's how those vaccines work. They make you form those antibodies, but not enough so that you get sick like you do now with the virus. So
We're talking about how accurate?
how accurate is it? That was what everybody was worried about, is how accurate these antibody tests were. And until I just heard this morning about the new Roche test coming out that's becoming more accurate, I think most of the lab technicians and directors that I was talking to said that the original antibody tests were only about 50% accurate. But now it's getting up into more like the 70, 80, 90% accuracy range. And so it has to be those specific antibodies against that specific virus. So there's a lot of coronaviruses that we've had before. We've all become immune to them. But it has to be specific for this new COVID-19 virus to say, yes, it's this virus that you now have antibodies to. And that's what they were waiting for, is that for that to become accurate enough to be reliable to say, yeah, you probably are immune, at least for this short period of time, or maybe even up to a few months, or maybe even up to a year. So,
Thank you, Dr. Antone. And I think the other thing that goes along with that question is also that until you get really, really accurate antibody tests, if you've got a population where not a lot of people have been exposed, you can get a lot of false readings on that could throw off what actually is going on. So that's why getting that accuracy rate up much higher than even 90% is going to be important. Fred?
Governor, will the Test Nebraska results as they start to come in be blended into the dashboard?
Yeah, so the question was, will the testnebraska.results.com results be blended into the dashboard that we've got for DHHS? Absolutely. It'll just get rolled in as part of our overall testing.
But will there be some sort of, you said last week there was going to be some sort of verification that they were being accurate before?
Yeah, so part of what we're doing is we're setting up our own lab, and we're validating the fact that the lab is set up and works and all that sort of, calibrate, all that sort of good stuff. But once that's done, the test will be sent to the lab, and then all those test results will just become part of our overall stream of reporting with regard to testing results. Paul?
And who is doing the lab work? Have you said
We have not made that announcement yet, so stay tuned. As we get the lab all set up, we'll make an announcement on it. So the question was, who is doing the lab? We're setting up the lab here in Nebraska, and when we're ready to make the announcement, we'll let you know.
that's coming soon?
That is coming soon, as a matter of fact, yes.
Tests today. Do we know how many tests to the private labs and the existing?
Dr. Antone, can you come up and talk about some of the tests coming back from the commercial labs and how much that is of our overall mix?
What's your capacity is now?
so Paul asked about the number of tests that we're doing now and where they're coming from, what labs they're coming from. And the governor announced or said earlier about the National Guard going out and helping us do the swabs for these tests, and it's been amazing. I mean, for a long time, we were getting back maybe 300, 400 tests a day. Now we're getting 1,300, 1,400, 1,500 tests a day. And some of that is due to our Nebraska Public Health Lab, again, having that pooling of samples. They're doing up to 400 to 500 tests a day just at the Public Health Lab itself. And then now some of the hospitals, some of the major hospitals, their testing machines that they have, they're starting to get reagents in. So they're starting to do more testing even at the local hospital level. And then we're sending a lot of the specimens out now to the commercial labs. The two main ones are Quest and LabCorp. And then those tests go out outside of the Nebraska area, and then it takes a little bit longer to get the results back. But from some of the labs that I've been talking to and some of the hospitals I've been talking to, they're coming back within 48 hours a lot of times now. So with all that taken into consideration, that's why we've been able to ramp up that testing from around 300 or 400 tests received back every day up to 1,300, 1,400, 1,500 tests per day. So
Do you have the percentage breakouts on how much is coming from commercial labs?
I do. Right now, the commercial labs are doing probably 30%, 40% of the test results we're getting back now.
We can get you the exact results.
I can give you those numbers, yeah.
Is there a number you're shooting for? I mean, what is the optimum number of tests you'd like to see happen in the state?
I think the governors have said this a couple of times, that the experts in epidemiology and infectious disease at the University of Nebraska said that a state the size of Nebraska should probably be getting back around 2,500 to 3,000 tests a day. That would be our goal. But with Test Nebraska, we're hopefully going to exceed that.
Do you feel like you're still on track for that within the 5-week window that was mentioned earlier?
The 5-week,
To get the tests ramped up in
It's-
Nebraska.
Grant asked, are we going to reach that goal of 3,000 tests a day? I'm very confident we will.
Great. Thank you, Dr. Anto. Other questions? John? John and then Fred.
Obviously, Congress passed more money going to states, $150 billion total. I know Nebraska's getting $1.2 billion. And I know we can't use that right now for lost tax revenue. What can the state use that money for? And how much is that going to help as of right now?
So the question was about the CARES Act money, which Nebraska received $1.25 billion, $166 million going to Douglas County versus the 100, whatever left over, 1.083 billion or whatever it was, coming back to us. And so we are using that to, for example, be able to pay for the expansion of the contact tracing, the testing, testnebraska.com, for example, all the expenses that are associated with anything with regard to the coronavirus, we can use it for. So there's a lot of things that we're going to be doing. We're going to be looking at how we can help other organizations, whether it's local government, nonprofits, for-profit, and so forth, with regard to anything where they've been impacted by the coronavirus. So we're looking at a variety of different options, but right now, currently, what we're doing is really focusing on what are the direct expenses we have at the state level to be able to help pay for things like the testing, contact tracing, and so forth.
We have time for just a couple more questions.
Fred?
I'm just not clear on what what Test Nebraska is providing. Is it basically equipment and analytics?
So, yeah, so the question was, what all do we get with testnebraska.com? So it was that what the companies were able to provide is the equipment, so be able to, the machines that will actually do the extraction and run the analysis, use the reagents to run the analysis, the reagents to actually be able to do it, the test kits to take the swabs, so the swabs, the viral media, the test tubes, all that sort of stuff. They're also supplying the algorithm with the software that goes behind testnebraska.com to be able to do the assessment, help you analyze where you should allocate your testing resources. And of course, that same software is what we use to be able to send out the emails, to be able to get people to register, to update their profile, to set an appointment to come in and get tested. So all the software that goes along with that. And then, of course, there's also the whole logistics of how you set these testing sites up. So they provide, based on the experience they've had previously, here's kind of a profile of how you can do that, though certainly with our National Guard, we've got some great experience with that already as well. So it's really a lot of the things that go into how do you get a program like this going. The thing it's not providing is the people. So we provide the people to set up the lab, to do the testing, and all that sort of thing. So we're supplying the people in. They're really providing all the equipment and some other guidance on the know-how and how you operationalize and make this all work. Paul?
What's your update on allowing people to sign up for Test Nebraska if we don't have internet access?
So the question is, what's the access, or what's the kind of update on, if you don't have internet access, where can you sign up for testnebraska.com? So we're still working through that. We don't have a call center set up right now. We're still working on just kind of getting the testing program out the door. However, great opportunity for community collaboratives, local health clinics to be able to work with people directly and see if there's a way they can't help people get set up in a way where they maybe facilitate that. So it's certainly an opportunity for local community members to be able to help out someone. Similarly, we're talking about, you know, helping seniors stay home by running errands for them. Maybe this is something local community groups can get together to be able to help people out with.
Like what kind of community groups?
Well, I mean, you've got all the folks who do Bring Up Nebraska, different nonprofits, church groups, that sort of thing. Maybe they could help people who don't have that internet access and be able to set it up that way. So maybe they could help by getting a pool of people together that check emails and that sort of thing and try and get people signed up. So great way for people to be able to reach out in the community and make it work.
Sounds like our call center won't be ready for a while.
We're not, yeah, we're not ready with where the call center is right now. We're still focusing on getting the whole operation up and running. You know, we're just starting to test today. It's day one. So,
Let's have friends and family do it because with
Yeah.
all the follow-ups
Right.
that ensue, you have to have someone who's working with you to schedule the time.
yeah, so Taylor just wants to, friends and family are always good to be able to help with that because there is a lot of follow-up with regard to the emails and everything. All right, well, again, thank you very much, everybody. I appreciate you all taking the time today to hear about our update. We will be back here tomorrow at 2 o'clock Central Time. Very much appreciate everything all Nebraskans are doing to be able to slow the spread of coronavirus here in our state. And please, continue to follow our 6 rules and stay healthy. Thanks a lot. We'll see you back here tomorrow. Thank you, Betty.